Well, it's obviously a fairly major procedure to have an aneurysm repair done by the open method. Puts a fair amount of strain on the body as a whole, and it's important therefore that they get a high degree of nursing and medical monitoring in the immediate post-operative period, and that's what we can achieve here. And so the sort of things we need to do are make sure that you know, their blood pressure is adequate, that their heart's beating effectively, that the kidneys are working, and so on and so forth. And the level at which we can do that here on the critical care unit is higher than that can be achieved on a normal ward environment. Well, normally we'd expect to be able to wake the patient up straight away if the procedure's been straightforward, as it usually is. The patient gets woken up in the operating theatre, taken to the recovery area for an hour or so and stabilised there, and then brought around here for us to continue the level of care such as I was saying just now. Occasionally, if the procedure is more complex or takes a bit longer, we might keep the patient asleep and bring them round sedated and still on the ventilator, on the breathing machine, and stabilise them for a few hours here before waking them up and then continuing the care. We'd normally expect to keep them for 48 to 72 hours. That's fairly standard. If there are other issues, then they may stay a day or so longer, but around about 2 to 3 days in other words.